Picture this. A city wakes up like any other morning. Kettles whistle, buses grumble, someone burns toast and insists it's artisan. And then, quietly, in a lab you will never see, a machine begins reading the genetic letters of a virus no one can see. Not its face, not its passport, its code. And that, right there, is one of the strangest superpowers modern civilization has built. We can now track outbreaks by reading the microscopic spelling mistakes of the enemy. That is pathogen tracking. That is genomic surveillance. It sounds like something invented by a sleep-deprived scientist and a Netflix producer in the same room, but it's real. It's routine during outbreaks, and it helps labs identify variants, monitor how pathogens change, and, when paired with traditional epidemiology, reconstruct transmission patterns that would otherwise stay hidden. Today, I'm taking you deep into the rabbit hole, without losing the trail. Because this story is not just about viruses. It's about how humanity learned to turn mutation into evidence, chaos into maps, and microscopic evolution into an early warning system. Let's begin. Act 1. The crime scene no one can see. Every outbreak begins the same way. Confusion. People get sick. Doctors notice patterns. Hospitals fill. Rumors spread faster than facts. And somewhere, a pathogen, virus, bacterium, parasite, is moving from host to host like a thief in the dark. For most of human history, we fought outbreaks like villagers hunting a ghost with a broom. We could see the damage, we could guess the root, but the pathogen itself? It was a rumor with symptoms. Then science did what science does best. It became gloriously nosy. First came microscopes, then microbiology, then PCR, and then sequencing. And sequencing changed the game. Because once you can read a pathogen's genome, you are no longer asking only who is sick. You are asking, what exact version of the pathogen is this? How is it changing? Which cases are closely related? Which cluster comes from one introduction or many? Is a new variant spreading faster? Are diagnostics, treatments, or vaccines likely to be affected? In plain English, the pathogen leaves fingerprints. Genomic surveillance dusts the room. Now, let's make this simple. A pathogen replicates, and every time it replicates, it has a chance to make copying errors, mutations. Think of it like a student copying the same paragraph millions of times. At first, the sentence says, "The cat sat on the mat." By copy number 800,000, one version says, "The cat sat on the hat." Another says, "The cat sat on the map." And one truly cursed copy says, "The bat sat on the mat." And suddenly, public health has questions. Those tiny changes become markers. Not always dramatic, not always dangerous. Many mutations do absolutely nothing. They're the biological equivalent of changing your socks before staying home all day. But some matter. And when labs sequence samples from different patients, they compare those genetic changes. If two samples are nearly identical, they may be closely linked in the transmission chain. If one carries a distinct combination of mutations, it may belong to a different lineage. If a new pattern starts appearing again and again and again, that may signal an emerging variant. So yes, this is part biology, part statistics, part detective work. Sherlock Holmes, but with pipettes. Act 2. The pathogen's diary. Now, let's make this simple. A pathogen replicates, and every time it replicates, it has a chance to make copying errors, mutations. Think of it like a student copying the same paragraph millions of times. At first, the sentence says, "The cat sat on the mat." By copy number 800,000, one version says, "The cat sat on the hat." Another says, "The cat sat on the map." And one truly cursed copy says, "The bat sat on the mat." And suddenly, public health has questions. Those tiny changes become markers. Not always dramatic, not always dangerous. Many mutations do absolutely nothing. They're the biological equivalent of changing your socks before staying home all day. But some matter. And when labs sequence samples from different patients, they compare those genetic changes. If two samples are nearly identical, they may be closely linked in the transmission chain. If one carries a distinct combination of mutations, it may belong to a different lineage. If a new pattern starts appearing again and again and again, that may signal an emerging variant. So yes, this is part biology, part statistics, part detective work. Sherlock Holmes, but with pipettes. Act 3. How the hunt actually works. Let's walk through the process, step by step. Step 1. Samples are collected. Patients test positive during an outbreak. Their specimens, often respiratory samples in a viral outbreak, are flagged for further analysis. And no, not every sample gets sequenced. That would be expensive, slow, and a magnificent way to make lab workers cry. So labs choose samples strategically. Representative surveillance, so we know what's circulating. Targeted sequencing when something looks unusual. Outbreak clusters, severe cases, possible vaccine breakthroughs, travel-linked detections, suspected reinfections. In other words, you don't sequence everything. You sequence what answers the most urgent questions. Step 2. The genome is sequenced. Machines read the genetic material letter by letter, or close enough for very smart reconstruction. The sample becomes a readable blueprint. Step 3. The sequence is compared. Scientists compare the new genome to reference genomes and to other recent samples. This reveals which lineage it belongs to, which mutations it carries, whether it clusters with other cases, whether something new may be emerging. Step 4. The data is combined with epidemiology. And this is the part most people miss. Genomics alone does not magically tell you Bob sneezed on Kevin at 4:12 p.m. behind the pharmacy. Real life is messier. But when genomic data is combined with case interviews, travel history, dates of symptom onset, contact tracing, geography, hospital exposure data, then transmission patterns become much clearer. That's the real power. Not raw sequence alone, but sequence plus context. So, if anyone tells you sequencing is a crystal ball, be suspicious. Science uses microscopes, not magic wands. Act 4. The pandemic that taught the world to read faster. If genomic surveillance had a global coming-of-age story, it was COVID-19. Before COVID, genomic surveillance existed, but outside specialist circles, it wasn't dinner-table conversation. Then SARS-CoV-2 arrived, and suddenly the world learned 3 uncomfortable truths. Pathogens mutate constantly. Those mutations can matter, and sequencing speed can change public health decisions. So genomic surveillance became the difference between something weird is happening and a new variant is rising. And that mattered because variants could affect transmissibility, immune escape, diagnostic performance, therapeutic effectiveness, and public health planning. So, genomic surveillance wasn't academic trivia, it was operational intelligence. It helped answer questions like, is one variant outcompeting another? Is this outbreak driven by one source or many? Are we seeing local spread or repeated importations? Do we need updated risk communication? Should treatment guidance be reviewed? In other words, when the pathogen changed its outfit, Genomic surveillance noticed. And, unlike your friend who gets bangs and asks, "Do you notice anything different?" science actually did. Now, slow down, because this part matters. A new variant is not automatically a supervillain. Mutation is normal. Evolution is expected. If you replicate enough, you will change. Most changes are noise. Some are useful markers. A few may alter how the pathogen behaves in ways that matter. That's why surveillance exists, not to panic at every mutation, but to separate signal from noise. Think of it like airport security. Not every traveler is dangerous, but you still check passports, scan bags, and pay unreasonable prices for water. Genomic surveillance is the passport checkpoint of an outbreak. It asks, "Who are you? Where do you fit in the family tree? Have we seen you before? Are you spreading faster than expected? Do you carry changes we should watch?" The mature response is not hysteria. It is disciplined curiosity. That might be the least cinematic sentence ever spoken, but it has saved real lives. Act 6. The family tree of an outbreak. Here's where the rabbit hole gets delicious. Once enough genomes are sequenced, scientists can build phylogenetic trees, branching diagrams showing how sequences are related. It looks like a family tree, except for microbes. Except instead of Grandma Ruth moved from Accra to London in 1962, it's this lineage likely descended from a recent common ancestor and diversified through local transmission. Same family drama, far fewer casseroles. These trees help scientists infer whether cases belong to one cluster or many, whether a hospital outbreak is likely connected, whether a region saw repeated introductions from abroad, whether a strain circulated undetected, whether a pathogen is evolving in a new direction. Now, important bridge. This does not mean the tree gives perfect certainty. There are limitations. Sampling bias exists. Some places sequence more than others. Some cases are missed. Timing matters. Metadata can be incomplete. But even with imperfect coverage, genomic surveillance can reveal invisible structure in an outbreak. Without sequencing, an outbreak can look like random dots on a map. With sequencing, those dots become a story. And humans survive by stories, especially the accurate kind. Act 7. Why this matters beyond one virus. This is not just a COVID story. Genomic surveillance applies across pathogens: influenza, tuberculosis, mpox, foodborne outbreaks, antimicrobial resistance monitoring, hospital-acquired infections, and future emerging threats we haven't named yet. Because the future of outbreak response is not wait until hospitals are overwhelmed and then improvise. The future is detect sooner, characterize faster, respond smarter. That's why so many countries after the pandemic pushed to make sequencing networks durable, not just emergency improvisations. Translation: the world got punched in the face and decided to buy better alarm systems. Act 8. The limits nobody should ignore. Now, because we're going deep, we also stay honest. Genomic surveillance is powerful, but it is not omnipotent. Limit 1. It depends on sampling. If a region sequences too few cases, a variant may spread before it's noticed. Limit 2. It depends on speed. A sequence generated too late is still useful, but less useful than one generated while response decisions are still active. Limit 3. It depends on infrastructure. You need labs, trained staff, reagents, bioinformatics, data systems, reporting pipelines. A sequencing machine without workforce and integration is like buying a grand piano for a cat. Technically impressive, operationally limited. Limit 4. It works best with other data. Sequencing complements field epidemiology. It doesn't replace it. Limit 5. It raises equity and policy questions. Who gets sequenced? Who owns the data? How quickly is it shared? Which countries have capacity and which don't? These aren't side issues. They determine whether surveillance is global in name or global in practice. And pathogens love inequality. They travel business class and economy. Act 9. The philosophy of reading the enemy. Here's the deeper layer. Genomic surveillance is civilization turning time into intelligence. A pathogen mutates over time. Every mutation becomes a clue. Every clue helps reconstruct movement. Every reconstruction can guide response. Evolution, once just a background process, becomes readable in near real time. That is staggering. We are not only treating disease, we are watching it evolve while it happens. The old world fought plagues mostly by reacting to visible consequences. The modern world, at its best, learns to read the hidden script underneath. And that doesn't make us gods. Let's all stay humble. A virus can still humble a planet. A bacterium can still embarrass a health system. A delayed report can still cost lives. But it does mean this: the invisible is no longer entirely invisible. And that changes everything. Act 10. The human side. Now, step back, because every sequence begins as a person. Someone coughing, worrying, waiting, isolating, hoping. Every outbreak map is made of families. Every cluster is made of birthdays missed, jobs interrupted, elders protected or not protected, nurses exhausted, and lab teams working under fluorescent lights while the rest of the city sleeps. So when you hear genomic surveillance identifies variants and transmission patterns, don't hear sterile jargon. Hear this. It helps public health move from blind reaction toward informed action. It helps detect change faster. It helps narrow uncertainty. It helps avoid fighting yesterday's outbreak while tomorrow's version is already spreading. It's not glamorous, but it's heroic in the quiet, uncinematic way that most real progress is heroic. Not cape heroism, spreadsheet heroism, pipette heroism. Why is the server down again heroism? Closing. Resolution. So the next time you hear the phrase pathogen tracking, genomic surveillance, don't let it pass by like technical wallpaper. This is the story of how humanity learned to hunt invisible enemies by reading their code. It's the story of mutation turned into evidence, outbreaks turned into maps, variants turned into warnings, uncertainty turned, at least partly, into strategy. The enemy may be microscopic, but the idea is enormous. If you can read the trail, you can respond before the fire becomes an inferno. And in a world where the next outbreak is a matter of if, but when, this may be one of the most important detective stories ever told. Because the difference between panic and precision is sometimes whether we read the genome in time. Optional YouTube outro. If this changed how you think about outbreaks, hit like, subscribe, and share this with someone who still thinks variant tracking means scientists staring angrily at bar charts. Because the future of public health is not just medicine, it's information, it's speed, it's pattern recognition. And sometimes, the most powerful detective in the city is a machine in a lab, reading letters no one can see.